On Tuesday, 7th of September 2021, the government announced tax charges or tax changes to fund $12 billion a year to be spent on the NHS and social care across the UK. Prime Minister Boris Johnson said the majority of the proceeds would go towards catching up on the backlog in the NHS created by COVID, increasing hospital capacity and creating space for 9 million more appointments, scans and operations. A portion of the money, $5.4 billion over the next 3 years, will also go towards changes to the social care system, with more promised after that. The tax will begin as a 1.25 percentage point charge or rise in the national insurance from April 2022 for 1 year. It'll impact those who make either Class 1 NI contributions, that's both employees and employers, Class 1A and 1B, and Class 4, that's the self-employed. Those above state pension age are not impacted by the April 2022 changes. From April 23, a new separate ring-fence health and social care levy of 1.25% will be introduced for all of the above groups, plus those over state pension age who are still in work but do not currently pay national insurance contributions. This group will start to pay the levy if they have employment income or profits from self-employment above £9,568. When the new levy comes into effect, national insurance rates will revert back to current levels. The new levy will be calculated in the same way as national insurance, administered by HMRC and collected through the existing NI reporting procedures. That's the pay-as-you-earn and income tax self-assessment. From April 2023, the levy contributions will appear as a separate item on payslips. And from April 2022, income from share dividends will also see a 1.25% tax rate increase, affecting those who receive dividend income from shares, including company directors who take their income as dividends. The essence of the plan is to introduce a cap on social care costs in England from October 2023 of £86,000 over a person's lifetime. All people with assets worth less than £20,000 will then have their care fully covered by the state. The threshold is currently £14,250, and those who have between £20,000 and £100,000 in assets will see their care costs subsidised. There was no mention of it in the 33-page policy paper, but the government has since confirmed that the accommodation-related costs of care, those associated with daily living, such as food, energy bills, and the physical building, would not count towards the cap. Only the costs associated with the actual care provided. These costs are also known as hotel costs. Previous incarnations of the cap following the 2014 Care Act suggested people's contribution to those accommodation costs should be fixed at £12,000 a year. That would cover a third of the total annual costs of an average care home, £36,000, but mean individuals could face £1,000 monthly bills even after they hit the cap. But if only £24,000 a year of an individual's costs count towards the total cap, it would take more than 3.5 years to hit it, and at that rate not many old people would live long enough to reach the total cap. Half of those in care homes die in a little over a year, with 3/4 not making it past 3 years. Care you receive in your own home would count towards the cap, but this tends to cost much less, and therefore people would normally need to be in receipt of that care for many years to hit the cap. Remember that a significant amount of social care is delivered to sick and disabled people of working age adults, where the NHS element of their care is free in most circumstances. This is not so for older people, where, for example, dementia is perceived as an irrevocable consequence of living to an old age and is consequently not viewed as a health issue, and so its treatment is deemed to be social care and has to be paid for by the user. Data suggests that 1 in 6 people over 80 are living with dementia. So if the government is raising about $12 billion a year for 3 years with these tax rises, where's the $36 billion going? According to the BBC, just over $2 billion of that goes to Scotland, Wales and Northern Ireland under rules of how the UK government spending is split. That leaves $10 billion a year for health and social care in England. Most but not all of that has been earmarked against particular elements of health and social care. About $6 billion a year has been assigned to the NHS, and another $2 billion a year will go to social care. A bit less than half of that will go towards the new funding model, helping people to pay for care, and a bit more than half going on delivering care, training for staff, support for councils, and work on making the care and health services work better together. Some of the remainder will be spent on tax, but there's still at least $1 billion increase that goes into other, with the government saying they'll announce further details in the coming weeks. Full details are yet to be revealed by the government, but as more information is coming to light, the cap contained within the paper may prove to be somewhat disappointing for the majority of those in care homes who pay more than the rate that the local authority is willing to pay, and also for those who will still be required to fund the accommodation element of their care, which is likely to run into hundreds of thousands of pounds. Thank you for checking out my YouTube channel. To find out more about the UK care system and funding options, check out my other videos. I'm Justin King, and my aim is to help people live successful lives, and that often involves understanding your money. If you've enjoyed this video, please press the like button to help more people like you find my channel. For now, I'm Justin King, helping you live your best life.